want to welcome Jon to the show. Thank you, Jon, for your time today. And how are you?
Ronnie, good. It's a pleasure to be with you.
Wonderful. Thank you. So tell us a little bit about you and your background. And let's start with your Survivor Support.net show that you do on Fridays.
Well, that's actually called Journey to Healing. That is on tecntv.com. That is a nice opportunity for me to actually delve into counseling topics for people. So that's live 8 to 9 p.m. Eastern Standard Time on tecntv.com. It's live internet TV, so it's a neat experience all the way around. I'm still learning my hands at trying to be both technician and host. But we're doing a deep dive into the topic of boundaries. We've been doing that for about a year or so. There's a lot to that. So that program is nice. As a licensed therapist, I've been doing counseling for about 30 years. It's neat to be able to systematically put together what I think are some of the key principles that can help someone that's wrestling with depression or anxiety or panic disorder or compulsive disorder. So that's actually kind of a nice break for me, although I do therapy throughout the week. So I have a full-time caseload, and my background is a little varied, but I've worked with a couple of key populations that actually then kind of set me in a good way, as it were, to be able to address the topic that we're dealing with. Because my background, not only working with regular kind of counseling clients, but also worked extensively with survivors of sexual abuse, with kids in the system, and then for 11 years with inmates, the full spectrum of inmates, but also sex offenders in the Pennsylvania Department of Corrections. I worked on psych staff. I was the first psychology staff in the U.S. to put together an intensive treatment program for men in long-term solitary. And from there, headed up one of the state's high-intensity treatment programs for sexually violent predators. I'm certified in the Hare Psychopathy Checklist. I've done hundreds of parole psych evals and risk assessments. So along with counseling regular folks, I also am still currently, because I've retired from the Pennsylvania Department of Corrections back in 2016, have been doing sex offender treatment now, as we call it, on the street, so for men on parole. And so I currently have 2 groups that I run throughout the week.
You have your
in my website, SurvivorSupport.net, that's a resource for anybody that has experienced the significant crossing of personal boundaries, shall we say. But it's more than just for survivors of sexual abuse. Anybody that's really wrestling with significant issues or wants to learn how better to support those that are experiencing that. And then also I have a training site that is called churchprotect.org and a blog. So I have a blog, SurvivorSupport.us.
Wow, you have such an extensive background, and thank you for all the work that you do now. So you have a really understanding of what is happening to our children and teens in schools regarding the agenda of the transgender deception, the gender ideology. So let's get into that hot topic of understanding the methods and the minds of these child sex predators, just so that parents can see these signs so that they can be alerted. And then maybe we could go into some few things of how we can protect our children.
Sure. Again, appreciate the opportunity, Ronnie, because the way I got pulled into this was sort of inadvertently. Because I was so steeped in forensic work at the time, from 2005 to 2016, my world was working with perpetrators. So I was unaware of, even though I was a dad of homeschooled kids at the time. I have 3 kids, now they're older. So in a way, I don't have any vested interest in stepping into this arena. My kids are grown, so I could easily justify not being involved. But because I know what this is, I feel compelled, as should any reasonable therapist. And I'm very frustrated that there's such silence in the world of mental health on the part of reasonable therapists. I understand there's fear, but there comes a point in time where we still need to speak up. So because maybe I'm fearless, maybe I just get etched. I feel compelled. So by the time I learned about the trans movement, I had the luxury of shock value, meaning I hadn't been gradually numbed and gradually programmed, there's no other way to put it, by this movement. And so it allowed me, as both an adult, as a parent, but as a professional, to really understand what is going on. So, what you have with the trans movement. So, as I try to convey this to parents, and I have a number of videos on my site that can actually go to SurvivorSupport.net under the podcast tab. They will find not only some of my Journey to Healing programs, but as a matter of fact, under the Insights tab, my apologies. So under the Insights tab, Insights 1, if they drop down, they will see two sub tabs. One is called the Trans Deception, and the other is What is the Trans Movement Afraid of? That is a repository of really the best information that I've been able to compile for parents. So if parents want to understand, both in terms of written material and videos, there's a one-stop shop, which is really my site. So go to SurvivorSupport.net, under the Insights tab, scroll down to the Trans Deception and What is the Trans Movement Afraid of? And you'll be able to spend hours and hours and hours on there, really educating yourself. But in brief, what you have in what we call the trans movement is an artificially crafted movement. Okay? It is not naturally occurring. This is the result of people behind the scenes creating what amounts to a marketing campaign that has a lot of money behind it, so that these very bright individuals from different sectors of society have targeted vulnerable kids. Mm-hmm. And they've done so in a way that it's come from many, many angles, to where now, because it's happened over time, people have come to believe that what they're being told and what we're being fed as far as trans kids and things, all things trans, they think it's real. And it is not real. Now, I'm not saying that this is not a real threat. It's not a real movement. What I'm trying to say is the idea of a trans person, a trans kid, it's not real. It's contrived. Prior to 2005, when I when I was on staff when I joined the staff in the Pennsylvania Department of Corrections, I ran a teen girls group home for really severe cases. If you want to find out anything true about teens, work in out-of-home care, mm-hmm. residential treatment, group homes. Not only do those kids have no filter, but they'll tell you what's true. They'll tell you they'll tell you about yourself.
Sure.
The idea of trans was never seen because it didn't exist. So prior to the year 2005, what I want parents to understand is there was no such thing as trans. And not because bright people prior to the year 2005, think about all the theorists, all the schools of counseling, all the medical schools. What we're being asked to believe is this, that everything prior to the year 2005 got it wrong or somehow missed this very real phenomenon that has taken society by storm like a tsunami. Mm-hmm. That now they have it right, that they've uncovered this reality that all the bright people prior to that, and in all our counseling textbooks and all graduate schools and all professionals in the field, from Freud all the way up to Rogers to Dreikers to, we could list family therapy and family systems, that somehow all those bright people missed this. Really? Well, that's quite a statement. Mm-hmm. Or this is something that was contrived and launched. And so I have some slides if you want me to share those now.
Yes,
or
absolutely. So you have the function on your end to screen share.
I do. Okay.
Parents really need to understand this trans deception, because I think they are really lost in what's happening because it's so heavy in schools right now.
Right. Okay. What I'm going to show you, first of all, is, let me bring this up here. I took the time. It didn't take too much time, but I wanted parents to see. Now, let me see if I can. There we go. Okay. This is dealing with Tavistock, which now they've just shut down the gender clinic. England has socialized medicine, the UK.
Your document didn't come out. Did you?
Oh, I'm sorry. Okay.
I'm just seeing all your files.
Okay. Well, that is absolutely fine because it's important that you see my files, actually. Okay. So let me see. Did it come up now?
Yes, the I am Jazz with the data
There you go. Okay.
bar.
Yep.
Yes.
So if you want to do some editing of this to make this smooth, there's just fine. But those files, by the way, are ones that I use in my programs as well. Okay, so what you have here, minus the pictures, let's just look at the line. We're going to look at the rate of referral. This is from Tavistock, which is now being shut down as far as gender referrals. If you didn't know any of what we're talking about, it doesn't matter really. You tell me, when have you ever seen a trend that looks like the beginning of a tidal wave?
Well, I mean, only the Christmas time when you get the Elmo toys or
Okay, there we go.
new
Right?
hot thing that comes out. You
There we
see
go.
huge
So
influx.
one could say that's the result of marketing.
Yes.
Okay. This is the rate of referrals over time. And I have overlaid some of the more significant influences. And we certainly have I Am Jazz over on the right. You can see when it really ticks up. There were a couple of shows before that. RuPaul really got things underway. RuPaul's drag racing, so he is a transvestite, but then you see the DSM-5. So what I want parents to understand, though it's a little fuzzy, I'm going to go to 2005. If you can see my little cursor, I don't know if
Yes,
you can
I
see
can.
it. Okay, there's 2005. Tell me the rates of trans kids. As a matter of fact, prior to 97, 95, how many? That number would be
Next to nothing, zero.
zero.
And then
if you extend that back 100 years, the rates are
still zero.
zero. This is non-existent prior to about 2005, really starting in about 2009 when RuPaul started his program. This did not exist. And RuPaul was aimed at adults. Now I'm going to bring up another
But
one.
what's the real catalyst to just shoot this up? Is it all that TV show I Am Jazz? Is that what really shot it up?
No, I'm going to show you.
Because some parents need to know that now that book with curriculum and materials is in classrooms all over Canada.
Now, can you see my screen again, the one that I'm bringing up?
Yes, I can.
Okay. This is the reason we have the trans movement. I added RuPaul, but I've overlaid then the different versions along the way over the years of what's called the DSM, the Diagnostic and Statistical Manual, which is the psychological Bible, so to speak, of all the disorders.
Mm-hmm.
Look at what happened in 2013 with the publishing of the DSM-5 that now included teen identity disorder.
Well, it started gradually coming up.
Okay, but look at 2013, what happens? It skyrockets.
Yes, the bigger blue one on the right there. Yes.
There we go. So it's because of that book that billing, that medical billing and reimbursement was suddenly possible. I call them the dirty dozen plus one. 13 individuals are responsible for all this.
For the creation of this major diagnostic?
Correct. And without that, you would go back to the DSM-4. How were the rates of referrals then?
That is the red one. Sorry, I'm not wearing my glasses.
Yes, the red one. And then you had an intermediate.
Yeah,
But these are the
it's not much, but this definitely this DSM-5 really took off.
okay, so the DSM-4, we didn't have the trans movement, okay, because you couldn't bill for it. You couldn't bill for transgender services, which still is not a diagnostic criteria. So if we increase it, there we go. Okay, so the DSM-5 made this profitable. That's why with the DSM-4, the rates of referrals are what?
Hardly anything.
Zero. Parents need to understand.
Oh, it's zero there where your cursor is.
Yes,
Yes.
I'm
There was
sorry.
a little blip just
Okay.
done and went to
Okay,
zero.
but if you look at the numbers, that's like 2 kids. That's a
Okay.
kid and a half.
Okay.
Okay, so my contention is this: get rid of the criteria that was placed in the DSM-5 and let's go down to the DSM-4 and see what happens to this movement. It's going to fade away to these numbers.
Mm-hmm.
Okay. This is a man-made contrived issue. Here's a very good video that I put together.
You mentioned 13 or more people who created the
Yes.
Can
You
we
can,
mention any of those who
Kenneth Zucker is one. Blanchard is another. Those are two more famous individuals that have dealt with gender confused kids. Okay, but and I noticed they have not come forward. Seeing this debacle, you would think at least somebody on that committee would step forward and say, you know what, I think we blew it.
Mm-hmm.
So we're going to go back to, we're going to take this out. We're just going to revert back to the criteria in the DSM-4, which was absolutely just fine.
Right.
But they won't do that.
No.
And my contention is, and I'm happy to put this on the airwaves, they are moral cowards. If they want to debate with that, they can come on my program anytime.
Fair enough. I'd like to see that debate myself.
Absolutely. I'd welcome that. This is a video that I put together. They can go onto my YouTube channel under my name, and this will give you an overview of, in my estimation, what the trans movement is all about. And in that video, I have this graphic. Okay, these are the influences that have a stake. So these are special interests. And the reason why Big Pharma is circled at the end of the video, I have this circle kind of going around the entire graphic. So I just did a screenshot as the video was going on.
Mm-hmm.
So what I call this is, these are all the special interest jackals that are feeding off the carcasses of confused kids, gender confused kids that have untreated mental health issues. We'll just go around quickly. I'll start with Big Pharma, then we'll go clockwise. You have Big Pharma. It's self-evident. The puberty blockers and the cross-sex hormones, major business. Okay. As a matter of fact, according to Jennifer Billick, in an excellent blog, it's called the 11th Hour blog, she puts the amount worldwide of this industry at 3 trillion. This is not going away.
Here.
Okay. This is big business.
Yeah, big bucks. Now, are we talking 3 trillion worldwide, or is this
worldwide?
Worldwide.
Okay, all because of the DSM-5, quite frankly. This thing goes away if we revert back to the DSM-4 criteria.
Mm-hmm.
Okay. So just from going clockwise, we have Big Pharma, big medical, and doctors and hospitals. This is big money. Plastic surgeons. Have I got a screenshot for that one? Look at the rates of plastic surgery, mastectomies.
Oh my goodness.
Okay. Big money to be made. And the red is girls. And that's 2016.
That is so shocking.
Okay? People want to believe that professionals are acting ethically. They are not. This is all about making money off the carcasses of these kids, where they're slicing off body parts. They sterilize them, and then they go after their sex organs. That's why anybody that truly cares about kids should feel incensed. And that's why I feel compelled to get involved. I'm going to go
Why
back
do
to
you
the
think
chart.
that it's only girls that they're targeting? Are they
Well,
more impressionable?
right. They target both. Okay. But it used to be that if either gender were going to feel uncomfortable and want to transition, it used to be boys. The reason why that it's happening to girls is a couple fold. They're more impressionable. We have the social media contagion, just like we had with eating disorders, but it has become now, in my estimation, a haven, supposedly a haven for girls that, in essence, want to be spared from what's going on in social media that girls are expected to participate in, especially what they see in pornography, which is violence against girls and against women.
Yeah.
So they don't want any part of that. And many of these girls, and actually I'll describe in the middle box there, though I have words in there, picture a quote unquote trans kid, which is really, there's no such thing. There are kids.
Mm-hmm.
No such thing as a trans kid. There are kids that are confused,
Yes.
that people are labeling them trans. There's no such thing. There are kids. We have kids that are hurting, kids that have been manipulated. So the best way to view this movement, which is man-made, it didn't exist prior to 2005. Without the DSM-5, this wouldn't exist. I want parents to understand that. The reason this is so difficult to combat and the reason it's taken everything by storm is there's a plan. This has been contrived. And that's why if we sit back and don't do anything, there are entities, and now we'll still go around the circle, but I'll describe the kids. So let's go around the circle first, then I'll describe the kids that make up that center right there, all feeding off them. So you got big pharma, big medical doctors and hospitals, plastic surgeons, transgender medical clinics and services, SOGI sex ed, which is what we're talking about, the sexual orientation and gender identity sex ed, where kids are getting groomed in schools. And what organization now is involved? Planned Parenthood, which is very interesting because I say Planned Parenthood is now turning girls into boys and boys into girls, and they are backing the men that are in drag, that are invading women's private spaces. And the question is this: why is Planned Parenthood, who supposedly was the protector of women, why are they backing the one group of people that are saying kill TERFs?
Kill who?
That's the trans exclusionary radical feminists, I think. Basically, like they're saying to J.K. Rowling. So the feminists that have said, listen, it doesn't matter how many dresses a guy wears and whether he gets breast implants, they cannot come into women's spaces. I agree 100%. So people came up with, these deviant men came up with this slur, and they call them TERFs. Okay, so to badmouth these women that are saying stay out of female spaces, these men have come up with this term, and they're so bold as to say that TERFs should be killed. But I don't see anybody raising an issue. Where are the marches in the street? Talk about an existential threat. J.K. Rowling stepped into this fray, and there's been death threats against her.
Mm-hmm.
When the We Spa, everybody remember the We Spa in Hollywood, where this one woman, to her credit, she sees this guy in the women's changing room with young girls in there, in the shower area as well. He has an erection, and she says, "What are you doing in here?" He says, "I identify as a woman." She goes to the front desk. She's got this on film. You can Google We Spa incident. Turns out he was a sex offender, a registered sex offender, which did not surprise me because people think that sex offenders and those that are predators, sexual predators, have morals, that they wouldn't stoop so low.
Well, of course they will. They'll do whatever they need to
Well,
do.
and that's why this entire movement throws the door open. It is the perfect grooming, sexual manipulation, sexual hunting ground for deviant men who will violate women and kids sexually, violate their boundaries.
It's
We're
just
going to
shocking
continue.
because schools are a big part of this,
Of course, they are. That's where sex.
kindergarten when they're coming in, and they're not telling them what their rights are. They're not telling the agenda. They're not saying anything. Is here you are. You can be a boy, we're a girl. Here's a transition closet if you need to go because your parents don't agree. Is I'm just speechless.
That's right. And here's the concern that I have for schools. Okay, as mandated reporters, every teacher is a mandated reporter, mandated to report
That's right.
suspected
Abuse
abuse.
to Ministry of Children and Families, and there's no phone calls going in.
That's right. And so what happens is that this movement has now caused all mandated reporters to reframe the red flags. There's 9, actually, there's more. As a matter of fact, I'll bring those up of sexual predation, kids that are being abused, kids that are being manipulated. Let me bring that up. It's right here from my
What
other
gets
show.
me is that there's teachers in here who are, some are unknowingly doing it and some are knowingly bringing this agenda in.
Correct. Because people that are porn saturated and have become deviant often, more times than not, become predatorial. So let me now go over these. Here's my greatest concern. And so my challenge to any educator, my challenge to administrators, my challenge to people in any field, medical, psychology, even churches now, but anybody that's a mandated reporter, the trans movement causes people by nature, the movement itself causes people to reframe the red flags of child of of possible abuse in terms of gender confusion. Here are the primary red flags, and see how many we see for kids within the trans movement. Okay, so these are the red flags that you would look for normally prior to the trans movement. If you saw a kid with a number of these, you would automatically think, if you were a educated mandated reporter that's gone through the mandated reporter training, at least yearly, if not biannually, these would be the red flags, especially for clinicians. It would be depression, anxiety. And think about how many kids in the trans movement have these things: panic attacks, self injurious behaviors. What am I talking about with self injurious behaviors? Okay, I'm glad you asked that.
You're talking about them cutting.
Let me bring up again. Sorry for the. You're getting a picture of what's on my computer, which is actually absolutely just fine. You can all verify that I only look at legitimate stuff. Okay, let me go to, this is all show prep for me. Okay, this is what we are talking about. If I can, oh, I can't find the other one. This will still be good enough. Okay, so people need to look at, this is the end result. Are you okay? First of all, how old is this child? I don't know.
I'm guessing if they had their breasts removed, I'm guessing they would have been 15, 16, maybe. I don't know. I mean,
It doesn't look very old though.
no, young. Maybe 12. That's the first thing that maybe came to my mind is 12 years old.
Here you go. Now look on her stomach and look up here on her arm. What do you see down there?
I see loose skin.
Okay, it could be loose skin. What else might make those marks?
Well, it's obviously an operation that they've had.
Okay, operation here, operation here. What do you think those might be? And what do you think right up here?
Well, the shoulder is a little bit hard for me to see. So,
Okay.
oh, I know what you're getting at. Are you talking about the injections?
No, this is actually from cutting. She has done that herself.
Oh,
Let
dear.
me see if I have another one. If I can find this one, and sorry that I may have to say.
I didn't realize that that was, I thought it was of operation of sagging skin, but you're actually saying
Oh,
that's from.
that is self-injurious behavior. Okay, here's another one. Let me show you.
Oh, oh my
Now,
goodness.
do you see a few scars?
Yeah.
Okay,
I,
now the question is this: which scars were first?
well, obviously the one that the child did first.
Okay. The question then is, do you think that the surgeon would have noticed?
Absolutely. They should have sought counseling
Okay.
first to deal
That's
with why is
that's
this child
that's the
cutting?
that surgeon had to cut through this scar. They're
Unbelievable.
self-imposed or self-inflicted wounds. Look at the size of this thing. Okay.
And they just went ahead and did the
They
operation
went
anyway.
ahead and did this. Let me show you another one. And again, my apologies for, I still haven't learned the finesse of all this. I'm going to show you another one.
Well, I mean, it's very hard to take in that,
Okay.
people are
If
just,
you think that's a one-off, here's a girl standing next to her mother. And the same doctor that worked with Jazz Jennings. Okay, now, so Dr. Gallagher did this. Do you notice anything on this young lady?
yeah,
Now, who's
lots
missing
of cutting on
breasts?
the shoulder, arms,
There
lower
you go.
abdomen.
So
Yeah.
from this, what, including the wrist?
Oh, I
So
didn't see that. Yeah.
is she left-handed or right-handed?
Oh, she's probably right hand.
How can you tell that?
Well, because of the way the person cuts, there's no cutting on the hand that they're dominant on.
Correct. So do you think the doctor in her pre-exam assessment might have seen these?
Oh, 100%. They should have assessed the mental stability of this person before doing these operations because it's showing that this young individual is not in a mentally health fit. I'm not sure from your point of view as a therapist what the word you would use, but this shows me that this is a child that's not stable, mentally stable.
Okay, that is the concern. That what you have is a significant amount of, and there was a study that was recently put out, about 85% of the young women that end up in the trans movement going through transitioning the process have had their sexual boundaries violated. 85%. The others are those that are on the autism spectrum. Then you have those that are being groomed socially on social media and those that are currently being groomed. That constitutes, in my mind, about 80% of those that are within the trans movement. Here's another young kid, and well, okay, right? People need to see, are people truly okay with this being done to thousands of young women? Right. And I ask people this: are you offended because I'm showing this to you, or that some doctor is doing this? These are healthy breasts, these are healthy
I'm not
women.
offended. I'm actually
You should
saddened
be.
for these
But
people.
people don't want to see this. They'll defend it, but they don't want to see it. So, how schizophrenic are we? Here's another one with Dr. Gallagher.
These are images that they should be showing in schools,
Absolutely, they should.
in
Well,
high schools. If they're going to be pushing this
there you go. Right?
ideology, they
It's
need to show them the proof. Hey, this is what you're signing up for. This is what you're going to get. But they don't do that. They show all the beauty and celebrities and look who's doing. Wow.
how's
Just
that?
sad.
Okay. This doctor, Dr. Gallagher, is just one. She's the third highest, how should we put, raking in the money. She owns a yacht. She owns a really expensive condominium in Miami. And she slices by the hundreds, if
What are
not,
these
well,
people's
she's up to
moral
thousands.
compasses? Where is their moral compass?
They have none. These are just like Nazi doctors. And we don't want to believe that doctors would be willing to be psychopaths. These are white collar psychopaths.
So
And yeah.
how are we? I know that we have
Oh,
so
and
many.
let me add one more. Okay. If you take the trans deception to its logical outcome,
Oh,
this is what every girl's going to have. But they won't show this. We push it, but the reason they won't show it is for exactly, Ronnie, your reaction. Meaning there needs to be full disclosure. What are we talking about with this movement? You're going to sterilize kids. This is the end of the line for the trans deception. When you hear of phalloplasty, when a young woman gets her breast chopped off, then they're going to create a fake penis. Where did they get the skin from?
They're getting it from their arms.
Thank you very much. And this is supposed to help a kid's internal emotional state. We're slaughtering these kids. Yet people are pushing this, and we're not supposed to see this. So now
all teachers, all vice principals, the BCTF, I'm calling you out.
Absolutely.
We're pushing this. You guys need to see these images and stop the insanity train.
Okay, now we'll pick it back up. Here's who's making money off these kids. We're going to continue Planned Parenthood. We got human services, social services, and foster care. Not necessarily going to say they're making money, but they're pushing an agenda. Sorry. Sales and marketing of trans products. We've got media and TV. Again, you can see this chart in the video that I put together, Understanding the Trans Deception. Corporations, media sponsors, and talk about blackmail. If you don't go along with this agenda, what will they do? They'll punish you.
Transphobic. You're a transphobic.
Okay, look at all the social media. And then here is my concern as far as my area of expertise. We've got pimps and human traffickers. Now what they're saying to these kids, and I have a video. I interviewed Alex Aharon. Actually, there's two different sets of these videos. I strongly recommend, if you want to find out how the porn industry is also and pimps and sexual predators are using social media, especially OnlyFans. So these doctors are so vile, the ones that are going to slice off breasts, that they tell these kids, and I forget under GoFundMe how many thousands of young girls are on the waiting list to create a GoFundMe page so they can get enough money to pay these diabolical surgeons that can make over $100,000 slicing off breasts. You can do 4 of those surgeries a day. Okay, so they tell the kids, well, as an option to earn money, you can try prostitution for a while.
And that's how the prostitution is linked into this.
Thank you very much. That's right. And then you have the porn industry, and then you have politicians that are receiving campaign contributions. Then you have social engineers, the riots that people saw in Portland and in Seattle. It turns out that in the major cities where we saw riots in the US, there are major transgender medical clinics. The cross-sex hormones affects kids in their thinking process. And then we have big foundations and endowments. So I will now get out of that.
Okay, so the hot topic, you and I could go on for hours about this, and I'm actually just sick to my stomach to parents not doing something and then teachers just going along. It has to stop. It absolutely has to stop. The harm, the long-term effects. It's just.
And people need to understand the pictures I showed you, that is the end of the line. Meaning, once kids get on the trans train, parents and educators need to understand this is where things are going.
So can we touch on, you and I were chatting earlier on the phone, how they are hijacking adults, kids, and teens, their subconscious, to follow along with this. And you were also mentioning about their boundaries. Can we talk about that so that people can see how this is happening to them, or they're the ones doing it and not knowing they're doing it? Can we touch on that?
Yeah. Those that are trying to manipulate, because again, think about the pictures. Are you really going to sell that to a kid? Say, hey, you start in this movement as this is the doorway in. We'll affirm you. We'll encourage you. But by the way, this is what we have planned for you. We're going to whack off your breasts. If you're a boy, we're going to castrate you. They're
not doing any of that. They're wrapping it up into this pretty little bow at school.
That's right. So you're not going to sell that. So they have to implement what cults have, the most sophisticated of cults, especially those that you will see, for instance, Scientology and the former sex cult NXIVM. these movements, so the trans movement, the trans deception has integrated time-tested, what used to be called brainwashing, but it's mental, emotional, and psychological manipulation. Ultimately, to cross boundaries, how you do that is ultimately you dumb down intuition. These people that are pushing this have no conscience. If you have no conscience, there's nothing to stop you from objectifying someone else. That's not just sexual objectifying, financially objectifying, treating someone as a means to an end. If you have no conscience, there's nothing left to stop you except for the other person's intuition. So you have to cause the other person to turn the volume down on their intuition. Your intuition is the mechanism within you. It's the flip side of conscience. It allows you to sense what's happening before you have enough information to really prove it, because this is sleight of hand. Because by the time you figure out that they want to take your breasts, trust me, your breasts are going to be gone. And so they're going to cause you to doubt what's in front of your eyes. They cause you to not be able to see it. They start with, well, I know what it looks like, but it's really not that. So that's why they don't want to show you these pictures. These pictures are the trans movement. You take a kid, the trans movement starts somewhere and it ends somewhere. We've now seen pictures where this ends. Mm-hmm. So if your kid or administrator or teacher, if your students get involved in this, it's a conveyor belt. You need to understand that by grooming these kids, what I mean by that is you are now shaping their mind to accept what will start to become more and more apparent. They have to get the kids and the parents to not question. And there used to be a phrase that we would all use. It's as basic as biology 101. Why would we use that phrase? Because there's nothing as basic as gender. A cult, a manipulator, a predator has to go after your intuition to cause you to deny what's right in front of your face. If the reason why they've gone after this born in the wrong body idea is if they can get you to question, if not deny, basic biology 101, you will swallow the Kool-Aid over anything. That's why they're going after born in the wrong body. If you swallow that Kool-Aid, they've got you, and there's no stopping what they're going to do. And what they're going to do is they're going to slice off body parts and say that you're better off if you're a woman, if you're like that at the end. But meanwhile, the kids they're going after primarily are sexual abuse victims, 85%. And those that have been severely abused, I didn't read the rest of the list. One of the symptoms of significant sexual abuse is dissociation, that it's not happening to me. One of the red flags that you look for in any kid that's being sexually abused is they will approach you and say, I wish I wasn't a girl. I want to be a boy. Why? Because the perpetrator is going after them. And the child concludes if they weren't a girl, the perpetrator wouldn't be targeting them. So it used to be an automatic red flag. If you had a child in front of you saying, I hate being a girl, I want to be a boy, or vice versa, that was always a red flag that this child is being perped on.
Mm-hmm. So it looks like everyone who is teaching is consciously knowing what they're doing.
They are now.
I'm curious where the paper trail is, where the money trail is. Are these schools getting kickbacks to put these posters out, to have these guest people coming in, transgender people? I've heard so many different stories of, rah, everybody get on the football game and let's get on the trans train and normalizing it. People have to start making these superintendents, these board of trustees, these teachers, these principals accountable for their actions, knowingly brainwashing these kids and targeting, like you said, the most vulnerable kids. It's got to stop. So just before we wrap up, we did really want to start with this new thing that you're noticing the last few weeks of destigmatizing bestiality, known as zoophilia. It sounds like a Disney cartoon. Can we quickly just touch on this, because you're noticing this is the next step coming in?
Sorry, my apologies. I think there's some gardeners outside.
Oh, no worries.
So timing's everything. Okay, what people need to understand is there is a stair-step process downward um, for adults into deviance. Okay, the term deviance simply means this: it's not equal to lust. Okay, lust is a few stages prior to deviance. When you hear the term deviance, what it actually means, as far as sexual deviance, and it's synonymous, is this: that the thing that arouses the perpetrator, the vast majority are men, so I'm just going to focus on male perpetrators. By the time a man becomes deviant, it's not about lust or attraction. They play our ignorance against us. They know we will project onto them how we think. So they play us for fools. Okay, I do sex offender treatment. I've worked with the most heinous of offenders. So, and people need to understand that there is a process, and it always starts with porn. Prior to porn and the internet, this process was always the same. It's a stair step process downward off the straight and narrow. Now it's a slippery slope. You get far enough into that, and there's a change that happens not just in the mind, but ever since porn and the internet. You will not find a sex offender that has not been deeply steeped in porn, or try it again, deeply steeped in porn prior to offending. And 100% of pedophiles, once they're busted, 100% are busted with possessing child porn, the vast majority with the dissemination or distribution, meaning they're passing along if they're not creating it themselves.
Mm-hmm.
Deviance means I'm going to use that common vernacular. I'm getting off on,
Right.
traffic, but I'm getting off on the impact I'm having on you. So it's no longer that you are, my concern is no longer that you're enjoying it. My concern is actually, and what is arousing me is your pain. And it's not in a kinky sort of way. I'm being aroused by scarring and marring your mind, your psyche, your emotions, and your soul. I am no longer normal, and technically I've become a sexual psychopath. There's two kinds: bloody psychopath, white collar psychopath. We find them all over the place, the white collar psychopaths in finance, in law, in politics. How many politicians do we hear that are perping on kids, also educate everywhere, quite frankly? Okay, so one way to have a tremendous access to a tremendous amount of kids is accessing schools. If you can get kids to accept that sexual perversion is normal,
Mm-hmm.
then they're already scripted, or what now is being called groomed.
Yeah.
They don't question it. And that's why girls are looking at this saying, what? You're choking me? Think about 50 Shades of Grey, and it's sold at Walmart as entertainment. That used to be torture in the Middle Ages. Okay. And the guys in prison could not believe when that movie came out. They said grooming's never been so easy. All the women now that are reading that book, they're grooming themselves. Okay? It used to be called sexual assault.
So how does this move into bestiality and zoophilia?
There's a progression downward. I did not know it until working with the guys. Not only did they come out with it, but I discovered it because of reading all the police reports that are contained in the criminal histories for these men, that the progression is the gateway pornography, Playboy kind of pornography, progresses then in terms of Penthouse and then Hustler and more graphic. It then all leads to, it's like an hourglass. It leads to what's called barely legal. As that's taking place, an increase in deviance. So you're not lowering the age, but you're also if you're a male predator or perpetrator, you're also after marring and scarring and defrauding and injecting, as it were, pain and trauma. If a guy doesn't stop at that age, he will go lower, because at barely legal, the young girls look older and the older women want to look younger. It all converges at barely legal. If a guy continues moving downward, the majority of sex offenders will not. And that hits about puberty. The worst of the worst will continue. The ages then progress downward, And then what you also find at the same time is abject degradation. You find pedophilia as far as what's in their taste, what they've accessed, and they inevitably will access bestiality. And this is where furries comes in now, because anthropomorphic art. So you have this combination of human and animal characteristics. So they will in their art they'll portray animals with human characteristics, especially genitals. And so these animals, the wolves or foxes or other kinds of animals in their drawings, become human-like. And so furries then is a perfect way for predators to cover their 100% of their identity. Parents will hand kids over to these adult men.
Mm-hmm.
Okay, so bestiality. So pup play, you're seeing men dress in like pups in leather, look like little dogs. It's all part of this. So bestiality, the kind of pornography that is accessed prior to child pornography, is bestiality. So if somebody wants to find out, do a search on the internet, look up child predator arrested with child porn, or a man arrested with child porn and bestiality, see what starts coming up. And you're going to see inevitably by the time somebody who is arrested for child perpetration, they'll always have child porn. There will be bestiality porn. So they access bestiality prior to child porn. And then after that, it is snuff porn, which is murder. And the reason for that is you hide the bodies. And then it gets into really deviant stuff, necromancy, which is sex with dead bodies.
Wow, you have educated me on so much of this. I know some from what I've witnessed or read myself, but you've educated me on so much of these topics. As we wrap up our show, is there any last words that you could, if you would like to, call out educators, teachers, because school is coming up? This is crazy train's going to keep going on. I am seeing the furries now coming into schools, kids wanting to identify as an animal, and we know where that's going to go. Is there anything you would like to shout out to parents in protecting their kids in September, or calling out educators? The floor is yours. Oh,
so there we go. I'm trying to keep the sound of the gardener.
The floor is yours.
Right? What I would say is this, to any educator, to any teacher, you either know in your heart of hearts that this is wrong or you don't. If you don't, then you're either part of the problem or you've been dumbed down and you're being used. So the question I have is this: how do you know if what is going on isn't making it easier for a predator to access your kids? I can assure you it is. We have to raise the bar on child protection. Do not lower it. This entire trans movement and all the SOGI sex ed is lowering the bar and making it easier for predators to come along and access kids. Am I saying that every adult in the trans movement is a predator? I am not saying that. What I'm saying is this: can you tell me whether or not the men that are interested in child sexuality are legitimate, or they're behind the scenes accessing the most heinous of stuff and are predators? You can't tell me that. And therefore, your ability to discern has been compromised. And that's a very dangerous place to be when you and me, when all of us are responsible for protecting children and raising the bar.
Jon, I want to thank you so much for coming on. Love to have you come back. We have so much information that we both want to cover, and I would love to have you come on in the future to do another segment. It was great having you on. I appreciate your time. Thank you for all the information you provided, and just thanks for taking a stand and educating all of us on this trans deception.
Ronnie, it's been a pleasure to be with you.
Thank you. Have a great day.